Hello, everybody. I am very excited to see everybody here. I want to quickly just say, hey, we are recording this session for folks that are joining now. This is the first of the career panels that we have been talking about, and I am so incredibly excited to have 4 of our illustrious alumni joining us to share their career pathways, their current positions, and their wisdom on how you navigate the complicated world of global health career planning. I'm not going to spend a lot of time talking myself. Most of you know me already. I'm Lisa McKean. I'm the Senior Associate Director for Experiential Learning and Graduate Admissions. But I'm really just fortunate to have been able to spend most of my time working with these amazing students doing the work that they're doing, and then hearing how they have gone on from their degrees to do amazing things in the world. We have 4 panelists joining us today: Sulzhan Bali, Dominic Lucero, Jordan Schermerhorn, and Maya Stevens. And I am going to allow them to, introduce themselves. All of them graduated from the Master of Science Global Health program, and all of them have had really interesting pathways once they have moved beyond their time here at Duke. Maya is not able to join us on camera, so you'll hear her voice, and I'm going to ask her to get us started. Maya, if you can introduce yourself to the group, talking about, who you are, what you're doing now, what you have done, and what year you finished the program, that would be phenomenal.
Awesome. Hello, everyone. Can you hear me?
We can.
I am so sorry for my loud background. Life after DGHI can sometimes get busy and you spend time on the road. And so I am a 2019 graduate of the Master of Science in Global Health program. Prior to coming to the program, I got my undergraduate degree in biology, and then I spent a year doing service around the United States. And then I learned about the DGHI program, and I was so excited that I applied to that and one other program. And I was like, honestly, I have to go to DGHI. It was the most, it was a warm experience meeting everyone, especially during the virtual interviews. And then I never had any regrets once I joined the community. And so while I was at DGHI, I was able to hold a few leadership positions, work within the Mary Lou Williams Center, and then also do research in Ghana. That research we were able to publish, and also after graduating, I stayed on to work with DGHI for 2 years. After working there, one of our old directors, Melissa Watt, she actually asked me would I like to move to Salt Lake City, where her and her husband had moved. And I went on to work with her and another doctor named 𝗣𝗲𝗀𝗀𝗀𝗀, who also is from Duke. And then we created like a little mini Duke team in Utah. And then I worked there for a year before I was accepted into medical school. And I am now a first-year medical student at the Medical College of Georgia. And so it's been a journey, but I wouldn't trade it for anything. And I know that the foundation I was able to lay while at DGHI made a huge difference in who I am now.
Thanks, Maya. Dominic.
Yeah, thanks, Lisa. My name's Dominic Lucero. I did my Master's of Science in Global Health and graduating in 2015, same class as Jordan. My path has been, after graduating, I worked for 3 months at UNC for a survey research center on tobacco surveys, but shortly after that, I was offered a job that I really wanted on guinea worm eradication in South Sudan with the Carter Center. So I took that role, and then unfortunately was evacuated at the end of my contract, and then took another role in Boston with a research consulting company called Global Data, and doing a lot of Excel-based forecast models for different diseases. But then in 2018, I got a job that I was very excited about, working with the Clinton Health Access Initiative on their malaria analytics, surveillance, and technology team. And so I've been with CHI since 2018, supporting malaria surveillance in Southern Africa and East Africa. And yeah, sorry, Lisa, other questions I should answer right away?
Let's start with that, and I promise to ask you many more.
Sure. Thanks.
Jordan.
Yeah, hey everyone. I am also a 2015 Masters of Science graduate. I came to the program from a bioengineering background at Rice University. I took a year off and then realized I needed a global health master's degree to get any job that I wanted. At Duke, I wound up taking a lot of classes at Stanford and sort of getting into the policy space that way. But my internship was a research project in Amman, Jordan, with a UN health agency. I have gotten not one, but two different jobs through friends I met through DGHI, including Dominic, who I did not know was going to be on this call. After I graduated, I started out, I actually wound up interning at the White House the summer after I graduated in the HIV AIDS policy unit. And then after that, I could not get a job for like quite a while and wound up following Dominic to the guinea worm eradication program, where I was in Chad for a year and a half. After that, I've bounced around a lot. I'm currently at USAID. Sort of at CDC on the side. And I've landed in this space sort of at the intersection of infectious disease surveillance and humanitarian response and policy. And I'll leave it at that for now.
Thanks, Jordan. Sulzhan.
Hi, everyone. It is so nice to actually be here and actually so nice to see Jordan and Dominic, who were actually TAs when I was, at DGHI. So I'm a graduate of MSc Global Health in 2016. I came to Duke University with a prior background in a completely different field. So I was coming from laboratory sciences. I had a PhD, but I wanted to get into global health, and I didn't know how to do that. So this is really where Duke and DGHI really came in and really helped me make that transition. After I graduated in 2016, I actually moved to DC to look for a job, and I had a small teaching gig with University of Maryland, talking about Ebola and lessons learned from Ebola. And while I was in DC, I started a consultancy, a short-term consulting role at the World Bank, where I progressed. And right now, I'm a senior health specialist at the World Bank. I am currently in the global team, but I'm soon transitioning into West Africa region. It's really nice to see you all here.
So thank you all. I want to just call out a couple of things that I heard across all of these wonderful narratives. One is the multiplicity of roles that people have moved through. Two, the normalization of the process of trying to find jobs and thinking about how we do that. I want to spend some time with you all talking a little bit about that and tips and tricks and things that you think are helpful. And then the other piece of this is this idea of moving between and connecting to various sectors, because I heard lots of that through this process. So maybe the first question I was going to ask, we can all giggle at, because I was going to say, has it been a straight line from where you started post-graduation work to where you are now? Yeah, that's clearly not the case for anybody. And I think that's actually one of the strengths of global health as a career, has been that ability to be flexible, but also to follow some of those. But I would ask you all, and again, I might start with you, Maya, like what influenced those pathway changes? I understand economics and pandemic impacted all of us, but just for the four of you, what were the factors that were influencing those decision points for you? And Maya, maybe if you can start us off.
Yes. So for me, I always knew I wanted to go into medicine as a physician. I just was not ready when I graduated from undergrad, and then I wasn't necessarily ready once I graduated from Duke. And so I learned that I loved qualitative research while I was at DGHI. And I was actually working with the Diversity, Equity, and Inclusion Committee. And I was offered a job just because I was like a student who helped and had an opinion, I guess, that was quite valid. And so I was able to stay on at Duke. And then I figured, okay, it was getting closer to me getting prepared for medical school. And so when I got the role with the other Duke team in Utah, they literally came at me saying like, hey, we know you want to get into medical school. We know you're good at research. How about you help us, we help you, and we will make sure you get into medical school. And that's all it was. Like, I've never applied for a job. The jobs that I've held, and I felt comfortable with both of them. And so it's not a linear path, but if you know where you want to end up, it makes it a little bit better for sure. And I mean, the network is amazing at DGHI, if you can't tell.
Thanks, Maya. Other folks?
I'm happy to come in here, Lisa, with my story. So absolutely not a straight path. It's been very serendipitous, and I'm sure you remember this, Lisa. So actually back, I still remember back in 2015, 2015, when we were supposed to do our course, our practicum, right? Research. Last minute, my research plan fell through. And suddenly, when all of my classmates were going to do their research, I was left without a research plan and without a project. And it was really scary. At that time, Lisa was quite helpful. She helped me brainstorm. I reached out to a couple of professors, and I ended up working with two of my favorite professors who ended up being my advisors, Mohammed Pate and Carrie Stewart. So at that time, I ended up suddenly at the last minute changing project to work on Ebola, lessons learned from Ebola and the role of private sector in Ebola response back in 2015. And this was in Nigeria. And for me, that really, really changed the pivot of my career. It was basically that time, the 3 months that I spent in Nigeria, looking at the role of private sector. That is what really helped me set forth in my career. So it was really serendipity in that. And it was just so that when I moved to DC and I knew that I wanted to get into policy, and I was trying to network a lot, and I reached out to actually Jim Kim. I had attended a talk given at CSIS, and by then I was writing to a lot of people at the World Bank. And I reached out to him. I sent him a paper from my thesis, and I thought I would not hear back, because why would the president of the World Bank have time for me? And weirdly, 3 days later, I actually got a phone call from his office, and his assistant said, "Hi, I'm calling from Jim's office." And I had to say, "Jim who?" And she's like, "Jim Kim, president of the World Bank. He apologizes. He's not able to take the call, but he was intrigued by your email, and he's asked me to pass on your resume to the person who's in charge of, which was then the Pandemic Emergency Financing Facility." So this is really how I got an in. It was very serendipitous. And really, it was basically based on all the work that I did in DGHI. And but don't give up if things don't work out.
That is a wonderful example of be bold and a networking piece. Jordan, Dominic?
Yeah, so speaking about how things aren't necessarily a straight line, I had a period of like 4 to 5 years after I had finished my first long-term global health job in the field, where I was like, I saw the vision for what I wanted to do in 10 or 20 years. And I was like, okay, how do I get there? A lot of those contracts, like with NGOs in different countries, are 6 months or 12 months. Or 9 months. So I set out pretty deliberately to jump around a lot in my early career and to collect like skills and firsthand experiences in different countries, in different contexts, like along different parts of the outbreak detection and response pipeline. So I really jumped around a lot. I had to tie together a narrative of like why I did that later on when I started staying in jobs for a little bit longer. But one thing I really learned is that you can do the same thing and tackle the same problems from a lot of different perches and like different types of organizations. I've worked sort of as an epidemiologist and on outbreak response and sort of laboratory trainings and stuff like that for NGOs, for humanitarian response organizations. I did a weird stint as a Navy contractor. And then I moved on to academia and the US government, sort of all tackling these same problems, just from different perspectives. And I found that to be really valuable because you're going to interact with those different groups all along your career.
Yeah, thanks. I'll jump in. Yeah, what influenced my career path changes? I mean, I'm sure as many of you will find out, maybe have found out, like searching for your first job is definitely hard, and job searches in general are definitely hard. And so the way that I managed to sort of move ahead in my career has been, I think, a couple of things that Sulzhan mentioned around one, just persistently applying for roles that you're interested in. When I first applied for roles at 𝗣, I applied for probably like a dozen different roles at 𝗣, and then had like 10 different interviews for like 8 different roles before I actually got like matched with one that was a really great fit for me. And then also networking. One of the great things of my time at Duke was just like the really great people that I met, from really great friendships to really great mentors and professors and connections. And for my first job, or my second job in South Sudan, I managed to get that one after connecting with Justin Lana, who's also a Duke MSGH grad, who had worked there before. So yeah, I think those are the main things for me, like persistently applying and networking as much as possible. Thanks.
So I want to do 2 things. One, I want to let folks on the call know that it's perfectly fine to start putting questions in the chat. We're watching it. I'll make sure we have some time for Q&A with the panelists directly. But please don't wait if you want to throw a question in, because sometimes those questions then disappear from our minds. I heard several things in what the 4 of you have just shared. I certainly heard the be bold. You know, you don't know that you're going to not get that call that says, sure, the president of the World Bank is happy to, you know, have this conversation or forward this information. But network, and to embrace variety, both in terms of the roles and the opportunities and perspectives, this idea of looking around and saying, I'm interested in this topic or this problem. What are the multiplicity of opportunities that might be around the edges of this? So I'm hearing embrace variety, being very bold, doing the network, having a long-term vision. I love, Jordan, this idea of like, I knew where I ultimately wanted to get. So I guess the question I would ask all of you would be, if I'm sitting in this space of how do I do that first network ask? Like, what would, from your experience, be tips or tricks or ways to communicate, or things that you found successful for that initial reach out, which is terrifying if it is a cold reach out? What would you suggest in those spaces?
I'm happy to start out here. I think a couple of things that come to mind for me are, one, just like know who's like already in your network. That might not be quite so scary to reach out to. So like I mentioned, my job in South Sudan, that was someone that I already knew at Duke. He was like a TA, and we had the same advisor when he was working on his PhD. It was Dr. Pan was my master's advisor. So that was just like a really great resource. Beyond that, I'd say, just like Sulzhan was saying, like just be bold. It is intimidating to just cold email or LinkedIn message or whatever somebody. Yeah, and I always felt a little bit weird about doing it myself, but nowadays, like when I get those requests, when I get a random email from some alum at DGHI or something, when I get a LinkedIn message, I always try to respond and be helpful. And sometimes I'm just very busy and forget. So I guess my advice would be to reach out to people, or first find organizations that you think are really great and people that are in jobs that you think are really interesting. And then find those individuals and reach out. And if they don't respond, reach out at least one more time. Because I've definitely like accidentally ignored people that I realized I needed to get back to a little bit after they reached out. So yeah, that's what I suggest. Thanks.
I would also just like to add that it's okay to be afraid as well. I don't think I necessarily have the boldness all the time. And so a lot of times I've been afraid to reach out. And so it's like sometimes like accepting, like a lot of times we have to first acknowledge where our barrier is, and then you can move forward. And so a lot of times I would reach out to mentors or people, especially like within DGHI that I trusted, and say like, okay, I'm scared. What do I do? Can you look at this email? And even with medical school, the same way, I'm like, okay. And then I'm like, actually, let's be bold. Like, I know who I am. I know what I bring to the table. And you're gaining all of these awesome skills right now. And so you can just market it and market yourself. And so I say, one, you can be afraid. And then two, remember who you are. And then you can be bold, because honestly, sending an email to the World Bank president is wild. And I love that.
I can jump in. I am also terrible at this. Don't know how I've ever succeeded at it, but I totally second Dominic's suggestion too. Like, if you don't get a response, it's not you. It's because the person has, 50 like spam marketing emails in their inbox that bumped above yours. So don't think of it as you are like making yourself vulnerable and reaching out. Like, think of yourself as being in the role of like the student or the person earlier in their career who's seeking advice. And I think people are typically pretty receptive to that. And if they don't respond, it's not you, it's because they're busy. My networking strategy has been to join a lot of like professional fellowships and like sort of professional working groups, and to aggressively make friends, or at least really friendly colleagues, by like hanging out a lot at conferences, and to sort of make sure they know what I'm interested in. And I will send people job applications all the time if I see a role out there that I think somebody would be a good fit for. And if you do that enough, people start doing it back to you. So that's one thing that's worked really well for me. For networking with academics, something that I've done a few times to some success is to like email them asking for a unlocked copy of their paper if you like don't have access to a publication database, and then they're flattered, and then you read their paper, and then that opens an opportunity for an email chain. And then lastly, if you get that first role and you wind up skipping around a little bit as your career progresses, definitely stay in touch with people you enjoyed working with at former jobs. I've had people I've worked with reach out to me, and then I brought them to my current organization. I've been the person who's sort of poached and winds up being recruited by somebody else who I just worked really well with. And so, yeah, stay in touch, come up with unconventional strategies if you're scared. And then again, remember that it's not you if you don't get a response.
I absolutely agree with all that has been said by Dominic, Maya, and Jordan, Elisa. But, let me just also say, one, absolutely reach out again and again. Don't be afraid. And the reason is, as Dominic said, like, people are busy. Sometimes people are on missions, traveling. They don't have access to email, so don't be afraid to reach out, because, you might think, oh my God, the other person's going to think really badly of me. But maybe, they haven't had a chance to see your email or reply because things have been really hectic. So don't be afraid to reach out for sure. I also really liked, the second point I'd like to make is Jordan's suggestion of conferences. Your conferences, your talks are really great places to network. I actually made some of my closest friends and people who, eventually became my colleagues at the bank later on at conferences. At CUGH, I met a very close friend of mine who is also at the bank now. She was in a completely different university, but we really bonded over our passion about global health. Similarly, any talks you can attend. For example, if there is a particular organization you want to work, or a particular field you want to go in, right? Try to attend those talks. So that's the second point that I really, fantastic point made by Jordan earlier. The third point I would like to also mention, take advantage of all the training that's offered at Duke. So how I figured out the email to reach out to Jim Kim? I actually had attended a networking, I think it was a networking session that Duke University was organizing, and they kind of give you those tips and tricks to network. And they also taught us how to figure out emails. So I basically had figured out 2-3 versions of it and sent out the email, who knew? It worked. So take advantage of the resources you really have at the university that you would find would be also very helpful when it comes to network. And don't be afraid. I mean, yeah, that's all I would say.
I'm so deeply grateful that we are recording this session because I cannot write fast enough for the pieces that I'm hearing in here. And I'm periodically just going to keep doing a little bit of this sum up piece because I'm hearing, the fellowships. I also am really struck because we keep coming back to the networking conversation about this idea of paying it forward. I love the piece, Jordan, when you were talking about with this idea of like, answer the emails somebody sends to you, forward the job descriptions. Those things build relationships as well. And I don't know that I've heard that so clearly stated. So thank you for that. We're starting to get a couple of questions in the chat. I want to go there in just a minute, but I want to ask you all to step back a tiny bit because part of what we also talk about is the ability to be flexible and think about and articulate the skills. And to build on, Sulzhan's comment about using the resources here at Duke, I would ask the four of you, when you reflect back on the coursework that you did while you were in the program, either within global health or just broadly at Duke, like what were the skills that you feel have been most useful or that you have relied on as you've moved through this piece? Everybody on this call with us are enrolled currently. So thinking about how they're going to utilize those things is helpful.
I'm happy to go first since we're waiting. Yeah, I think Duke was actually really instrumental for me, Lisa. So in terms of what was most useful, I think the research, the fact that we take 3 to 4 months to do research in a country that, it could be United States or outside, but it's field work. I think that's really the most critical part. At least for me, that field work really pivoted my career in the direction I wanted to go, which was towards policy. And fun story, Lisa, many years later, I was actually, at that time, I think I was an ETC, an extended term consultant with the bank. And I went to Nigeria as a representative of the World Bank. And somebody mentioned to Chikwe, who was then the head of Nigeria CDC, that I'm the person who had written the thesis on which they had based a policy on how to engage with private sector during health emergencies. And it was a very hilarious moment. So, just to say that choose your fieldwork wisely, choose it in an area that you are passionate about. That will make a lot of difference. I think the other things that was really helpful, knowing qualitative research, at least in policy, you use it a lot. So, that has been really instrumental. A lot of knowledge work that has happened that I've been involved in with the World Bank has been qualitative quite a bit. Of course, quantitative, but that's also the qualitative aspect is also there. So that's been quite useful. The other thing that was really helpful for me was actually being able to take courses, not just in DGHI, but also in Stanford, the School of Policy, and also in 𝗣𝗲𝗀. So I had one course in Stanford, which I had taken with 𝗣ጵիս𝗲𝗶𝘀𝗁𝗀, who was a former country director at the World Bank. That was very useful in terms of understanding that, if I wanted to go work for the World Bank, what are these, how do these international financing institutions work? So that was useful. The other thing that was very useful was also, as part of I think me and another colleague, another classmate of mine, were one of the 2 first people from DGHI to participate in the 𝗣𝗲𝗀𝗀𝗀 practicum, which was also fieldwork. So my fieldwork was for that practicum was in South Africa. And again, that was useful. So I think the fieldwork and the health systems class, really useful. So yeah, a lot that I learned actually at DGHI, I have applied it at the work I do ever since.
Thanks, Sulzhan. Other folks want to hop in on this?
Yeah, I think the hard skills that I learned at DGHI that were most helpful in my career were one, learning Stata. I think that was mandatory for our class, and I think I think they might have switched to R now, and that's I mean that's great. That's what I use now. I don't use Stata quite so much, but still that was my first time doing any sort of programming. So learning how the sort of concepts behind that then I could apply to R, which I use more now. And then I think probably the biggest one for me was learning ArcGIS. I joined an ArcGIS course with the Nicholas School, the Environment School. And that was like, I think one like hard skill that really made me stand out that I don't think is, at least at the time, I don't think was like super common in a lot of the folks that were applying for jobs at the time. But yeah, besides that, I agree with what Sulzhan was saying around, especially with just like the research, the whole process of being able to plan, budget, carry out, and then conduct the analysis and communicate your findings. I think all of that is really critical and can't be emphasized enough. And then I was also going to mention, I think just like knowing how to read and quickly synthesize academic papers, I think is a really important skill that can sometimes be a bit overlooked. So I think that's something that Duke also helped me with, and can be a good thing to sort of be a bit deliberate and thinking about. Yeah, that's it for me. Thanks.
And then I wanted to hop on camera at least once. I would say I would kind of echo what has been said before. The research skills and the partnership skills with global partners really has done wonders for me in my confidence, but also like I've been pinned some like qualitative research expert, and I don't know how, but that was like a few of the ways in which I was recruited for work, and then even recruited recently to start doing some research with a team in Cleveland. And it's just because like I have published papers, I'm able to very comfortably speak about qualitative research. I think I helped TA a class while I was at DGHI. And so like being able to use those skills, write papers, like look at papers, people really want that skill. And you're actually really cool when you can do that no matter where you go. It's very cool in medical school. Everyone thinks like, oh, I have research, Maya, tell me what to do. And I'm like, all right, let's sit down. What's your interest? Do you want to go to conferences? Actually, you need to go to conferences. Like this is how you leverage. So I think those skills were great. Going to conferences is great because it teaches you how to network in both formal and informal settings. And then I would say just the partnerships. I think when we were there, we were creating a brand new partnership with Millennium Promise in Ghana. And so I still like WhatsApp and Facebook message and Instagram message some of the people that we worked with while I was there. And so that has allowed me to just be more confident as a researcher and now as I'm going into the field of medicine.
I can hop in. I've got some guys doing yard work right outside my window, so I'm sorry if you can hear that. But I totally second, everybody's mentioned the value of the research skills, and I completely agree. I would also add that when you're hiring, a lot of like Masters of Global Health resumes can blend together. So I would pick out sort of the specialized classes that you took and really own that. I know Dom and I both took epi methods courses with Larry Park, where we covered like DAGs and causality models. About a year later, I was working with some very senior and much older CDC epidemiologists who were like, what? They just like hadn't been exposed to that. So like you guys are really getting some cutting edge skills and these specialized classes. So be sure to highlight those on your resumes and what is something you bring to the table. You know, if you're taking a lot of WASH classes, congratulations, you're a WASH person when you're hiring for, or when you're writing applications. So figure out what makes you unique and what distinguishes you from, in terms of skills, from other applicants. I also agree with the hard skills. There will always be somebody hiring for R. There will always be somebody hiring for GIS. So lean into those, keep those skills up if you can, even if it means taking like a little refresher online class or making up your own project every once in a while. The other thing I would add is I think there was a good amount of writing in the DGHI curriculum, especially for the research and thesis components. Just being able to like justify yourself and write clearly and concisely about technical issues. In my current role in government, that's really, really important. I had something this morning where it was like, okay, write about how, okay, justify for Samantha Power why she should meet with the Maldivian Minister of Finance at the World Bank meeting next month. So I did that. I had like 45 minutes. And, being able to write quickly and clearly and think about how systems interact is super transferable. So if you can learn to do that well at Duke, that'll pay dividends.
And can I add one more thing onto what Jordan was saying? When she mentioned like owning one of those skills, I really agree with that. And even to add on to that, I think trying to really like demonstrate those skills on your CV, because like when you're hiring, the recruiter might see like a lot of people that just have like in their like skills, or I took a class in this, but if there's something that you can do to try and like really demonstrate your ownership of that, whether that's through your thesis, other creative ways, like Jordan, I think, wrote like a blog post about like doing some like epi analysis on Game of Thrones characters. So just like trying to like really like demonstrate like, hey, this is like a skill that I have, and here's proof that I know how to do it, besides just like slapping it on my resume. I think would be a really key thing as well to make you stand out.
Amazing. Okay, I'm going to need a link to that blog post. I think we can share that as supplemental reading assignments. I love that idea. But this focus on being both looking across your coursework and seeing what are the broad skill categories that you're doing, and then the deep dives into the technical and specific things is incredibly helpful. And I appreciate that Dominic, you might say, sorry to Jordan, I'm very excited about this. I want to go to a question that was in the chat, and I want to encourage people also to start thinking about unmuting and asking questions directly. But one of our first year master's students, Brilliant Human, has put in, when should I start the job application process? What's an ideal time frame if I'm a year out from graduating? What would you all say to that?
I think this totally depends on the industry and on the field. I can speak to government hiring timelines. I think, I'm trying to remember exactly what it was, but I think I got hired for my current role over the process of like 3 or 4 months. And then I had to get my security clearance, which took a year because I had so much international travel and, blah, blah, blah. So I think I went like 14 months between submitting the application and actually coming on board. I've had anything US federal is going to be a process. So if that's what you're looking for, get any job while you're waiting. Don't be me and like hang around for a little bit, thinking it'll happen quickly, because it won't. That said, I've had other jobs where they're like, okay, we need somebody now. Can you move to Nigeria in 2 weeks? Those are typically going to be like NGO jobs, and humanitarian jobs are very, very quick. It's like, there's a crisis, we need to staff up in this country, let's go. And then everything else I would say is in between, like 2 to 3 months in the field, I think is pretty normal for US based roles.
Let me add to that from my end, Lisa. I would, if you're a year before graduation, I would just start now, at least start with the networking, start volunteering. So when I was at DGHI, I was already trying to do things on the side, not working, but volunteering. So for example, I was involved in This Week in Global Health, which was at that time a video blog on global health, that gave me a chance to get a little bit more exposure. I remember like proper networking for jobs, I started doing 6 months before my graduation, but I felt that was a little bit too late almost. I would really start doing that as soon as you can. Start thinking about where you want to go, start building those connections so that, when you apply, things are a little bit easier. People know who you are, or at least are familiar with the work that you are doing, whether in your research or where you're coming from. So yeah, I would start maybe a year or at least 8 months before you graduate.
I'm going to quickly hop on because Maya had let us know that she would have to drop off the call to go and have some patient contact right about now. So Maya, I don't know if you just have any like tiny last little words of wisdom you want to share to this group before we get back to broader conversations.
I can hang on for about 10 more minutes.
Oh, yay. Okay, then I want to open this up to the group to say, do folks want to unmute and have any questions directly to our panel? And I will point out this is a moment to network, people. Okay, well, while folks are thinking through their questions, I am very struck by the variety of experiences here on this panel. And I would just, if I were to ask each of you to say, this is the global health sector that I feel that I am working in at this moment, what would you identify as your primary global health sector, knowing that we're very intersectional?
I'm happy to start, Lisa.
Sure.
Yeah. So I think my sector, my focus is on global health policy, and I primarily work on health emergencies and resilience. So that has been my focus. And incidentally, that has been my focus actually since I was at Duke. Yeah.
Okay.
Yeah, for me, it's malaria surveillance and analytics. Yeah, I think pretty straightforward. Yeah, epidemiology, infectious diseases, malaria. Yeah.
Okay, sounds good.
I'm going to sort of cop out here and say global health security, which is this, again, this very broad intersectional term that people use in different ways to sort of mean anything, but it's really sitting at that intersection of policy and action, and being able to translate between those two things. Yeah.
That sounds terrific. And I do see that, Chin, do you want to unmute and ask a question?
Yeah, hi everyone. Thank you so much for being on the call. I'm currently a second-year graduate student in the Global Health program, and I was wondering if you had any idea what job titles in global health are the best to apply to. I've seen research associate, policy analyst, and program manager, but often these roles require 3+ years of experience. So I was wondering if you had any recommendations for purely entry-level roles following graduation.
Yeah, I think that's a great question, and I can maybe start. I think if you are just graduating, I think analyst roles, if you don't have a lot of experience, are a good entry point, especially in the policy world, right? So I would really look a lot at that. But then, of course, if you have more experience, I would look at beyond that as well. So, for example, when I graduated, I did have some prior work experience. So for me, I was looking at more specialist roles. But usually, if you're at the entry level, I think analyst roles are really good roles to look at least in policy.
Yeah, sometimes research associate roles can be okay with your master's, and I'd say that when you're adding up your experience, I think you can definitely include your time working on your thesis. But another thing is I was very annoyed with CHI for a while because there were these jobs that we posted as volunteer roles. But I found out later that some of those roles actually are paid, or at least have a somewhat decent stipend. So yeah, just to say it can be worth reaching out to understand if you can't afford to do a volunteer role after graduating with debt and everything, to at least reach out and just make sure this does sound interesting. Let me just check and see if there is some reasonable salary or stipend, or even if it's something that could be accommodated.
I would definitely say look for roles that give you accommodation, because the world is not cheap and there are enough. It can be challenging finding the perfect role. I did do the job search about 6 months before graduating, and I was having varying experiences. However, there were definitely roles that were willing to pay. And so I would probably look for something that is paid if possible, or you receive some a stipend or something that's comparable.
I'm going to agree with what everybody else has said, and I realize this isn't exactly the question, but make sure you get paid. I spent my 20s desperately underpaid and regret it now. But sometimes that's what you have to do for the first or second job. Secondly, if you are getting an international job, like if you are working with an organization in a country, something to add is that they often cover housing and you get a food stipend and things like that. So it's normally like a group house or something like that. Or they might make you like rent your own place, which like I know Dominic does where he lives. So just figure that out when you're negotiating. On titles, I hate to say this again, but it's going to be very like specific to the field and even sometimes the organization. When I was working in the Global Health Security Department at Georgetown University, our research assistants were like people who had undergraduate degrees who were in entry-level roles, and then people with masters, they would be either like a research associate or senior research associate. Then again, like my first full-time job after my master's was as a technical advisor, which I now think of as a more senior role, but can really be used as a vague term for anything. And again, this is just for federal roles. I would say analyst is typically higher level. They want you to have like 5 to 7 years of experience, but it varies. The solution to these things varying is to LinkedIn stalk. Find people who work for the organization that you're targeting, figure out how much experience they had when they took on that role, just like via public information. That can be really helpful.
Can I just add something more, Lisa, very quickly? Definitely look at what the requirement is, but let that not limit you. And especially, this is especially true for women. Women tend to more, and this has been proven in a lot of research, really make sure they're 100% meeting the criteria. Say it requires three years of experience, but you have only 2. Reach out. You might still make a fit, right? So don't limit yourself to just what's really written. I would really encourage you to, even if you meet 60% of criteria, apply, reach out, network. So that's something I really want to kind of say that here.
And then I also want to add in quickly, just adding on to what Maya was saying. I definitely agree with what she was saying. Like it's not worth spending a lot of your time just not getting paid for your work. I agree with that. And then jumping ahead a little bit, when you do get a job offer, it never hurts to just try to negotiate the salary. I didn't know that, but like now, like as I've like tried to hire people, like no one is ever gonna like rescind an offer because you ask for more money like that. And if they do, then you would not want to work with them. So yeah, always just ask about negotiating or try to negotiate and then see what they say.
Couldn't agree more. Can I just like quickly say, Lisa, that's a really important point. In my first job, I never negotiated for my rate, and I later found out everyone did. So the next time I changed my job within my organization, I negotiated hard. Yeah, but also when you're negotiating, negotiate smart. Do your research a little bit. Know what other people with your skill set are being paid, so you can actually ask for something that's relevant for your experience. But great point.
Amazing wisdom being shared. I will second, and I'll like do my like glitter thing around the negotiating piece. I want to also call out what Jordan had said about the idea of thinking about total compensation in the negotiation space, because some places we know that may have salary caps or a less of an ability to negotiate a hiring specific rate, may be able to talk about additional compensation that is associated with the role. Could be housing, could be insurance benefits, could be the work schedule. So negotiate. You all are incredibly valuable folks and need to be compensated and treated in that space. And it's a hard ask if you haven't done it before. It feels a little bit like, I'm so relieved somebody wants to hire me, but I would like them to want me just a little bit more. Any other questions from folks that are on the call? I see Alice. Do you want to unmute and ask?
Hi everyone, I'm a student from DGHI first year. Just have a question about how to make myself standing out from different competitors, because when we apply for a job, if we just simply like send out resumes, we will be like in the resume sea, like the resume ocean. That would be too much and too competitive. Is there any way that we can let the HR remember us, like in a more direct way? I heard about sending out like coffee chat invitation, but I'm still wondering how people like schedule that coffee chat, like how close they are to schedule that chat, and what do people usually talk about in those kind of connections, coffee chat?
I'm happy to start here, Lisa. So it's a really good question. Yeah. So I think, today you have a lot of tools available. So when you see a job, look at what the job is asking, look at the keywords, try to include those keywords in your resume. So in a way, tailor each resume to the job a bit more, especially now that we are in the age of AI. In some places, they actually use AI to screen for keywords. So try to include those keywords. On the coffee chat, which is slightly different, right? Like when you reach out to people, know a little bit more about them, read what they've done. So, often what really helped me was reading a little bit about the work the person has done. So I would reach out with, and, when I speak to them to ask what is the current work looking like in their field, but I knew about the work they were doing. And that really helped. So read a little bit, read a paper. If it's an academic, read a little bit about the work the person has done, look at the LinkedIn, right? And then reach out and ask for literally, 10, 15 minutes. 15 minutes is usually a good block of time, 15 to 20 minutes. I noticed when I used to write, if I asked 1 hour, it would be hard. But if you ask for 15 to 20 minutes, that's a good spot of time to at least to make an initial contact with people.
Thank you, Maya. I see the notes in the chat, the takeaways. That is incredibly helpful. And we appreciate your time and your ability to join us today. I know we are winding down on the time that we have with our panelists. And I'm so grateful for the wisdom shared here. I had a, final question that was going to be asking all of our panelists to say, could you pinpoint one thing that you would say, what would be that key piece of advice for a student exploring careers? But I feel like you have given so much very specific advice that for me to say, please distill it down to the one thing. If you feel like you have that, great. But otherwise, I might wind up our conversation here by asking each of you who are on the call to let us know, what are you most enjoying about the work you are doing right now? And I will start. You nodded a lot, Dominic, so there you go. I'm going to start with you.
Sure. Yeah, I'm very lucky. I really do love what I do. And that's because I get to do a lot of data analysis, which I'm very interested in. I feel like I'm always learning new things. Like I learned R on the job here, and that was really great. I get to work with really great people from all sorts of different backgrounds, and that's really great. And I feel like my role lets me make some sort of impact by helping to build health systems and train people specifically that are going to be around for probably longer than I will, and really help health programs to make the most informed decisions as possible with the data that they have. So I think just being able to help with informing those decisions, I think, is a really great part that I love about my job. So thanks.
Jordan?
Yeah, I have a one thing, if that's okay. I think I would say take jobs because you like what you'll be doing day to day, or because you like the skills that you'll be gaining, not because you think the title's fancy or because it'll get you to the next thing. Every time I've taken a job because I'm like, this sounds fun, or this will be impactful, or I'll learn a lot, I've had a good time. Every time I've taken a role because I think it'll be a stepping stone to the next thing, I've really hated it. So be clear about taking roles for the right reasons. I'm gonna make this a second thing. If you're working for the U.S. government, or if you're interested in roles at USAID or CDC, the number one piece, and I'm mentioning this because people don't bring it up enough, I think, because it's a huge reason for rejection. The number one reason people get offers rescinded is marijuana use within the last year. So putting that out there, FYI. About what I do. So on my CDC consultancy, I work a lot with field epidemiology training programs where we're training cohorts of epidemiologists in these other countries who are really excited about their opportunities to grow, who have some skills, but haven't necessarily had the opportunity to come take a master's course at DGHI. And so I really enjoy training and working with building international teams to solve their own problems. In my role with USAID, I work a lot at embassies, which hire massive numbers of local citizens of those countries for their staffs. And so one thing we've done creatively is empowering them to be deputy office directors. They might not be US citizens, but they care about the development problems in their country. And so throughout every role, I've really enjoyed building up local teams and enabling them to grow in their roles. And ultimately, that's kind of the job of global development, right? Is to help people manage their own problems.
So I love my job as well, Lisa. Absolutely adore it, every aspect of it. So, in my role, there are different areas. There's obviously the partnership aspect where, how we engage with WHO, how we engage with different bilateral governments, other governments, right? Our client countries, which I enjoy quite a bit. There's an aspect of capacity building, doing trainings, strengthening capacity of countries, so that they can advocate for investments in health systems, so they can advocate for investments in health security and health emergency prevention, preparedness and response, right? So that's a big part of it. But the most important, the two aspects that, in addition to that I really enjoy a lot is actually one is solving problems together. I've had a chance to actually work with governments to address whether it's, dealing with an outbreak or post an epidemic. How do you really strengthen the health system, working with them together in partnership, thinking about a problem together, solving it together. I had a chance to work on some of the landmark projects, flagship projects at the World Bank, whether it was the largest disease surveillance program in West Africa called DGHI, or helping finance Africa CDC in early days. So, that has been really, really, cathartic. It's been it's something I really, really like, working to solve problems together with the countries. And the last aspect, but not the least, is really the thought leadership. I've had a chance to lead two flagship reports for the World Bank, one on health system resilience, the other on One Health and preventing pandemics. And again, that helps really think about policy. What should countries be thinking about policy? What should we as organizations be thinking about policy in the future? And I think that's another aspect that I really enjoy at the World Bank. So really 4 aspects, working to solve problems together, capacity building, thought leadership, and partnerships.
Thank you, Sulzhan. Thank you all so much. I really want to just take a moment and recognize the panelists who have joined us today. It has been just amazing to hear you walk through all of these pieces of advice, but also sharing the pivot points for yourselves. I'm grateful for the wisdom shared here. I want to encourage the folks that are on the call attending to note that we have another panel next week, and we will have more of the DGHI alum able to talk a little bit about their pathways. Thank you all so much. We will share the recording afterwards, and I look forward to continuing to follow all of the wonderful things that you are doing. Many, many thanks, everybody.
Thanks so much for having us.